The global health body has said that China risks grossly underestimating the true death and case toll. Since the beginning of the pandemic, the WHO has been siding with China and has been under fire globally for ignoring the very clear danger signs emanating from the Chinese mainland. Here's a look at how the WHO time and again has seemed to favor China and ignore good sense.
Everyone recognizes this face, a household name thanks to the COVID pandemic. But Dr. Tedros Adhanom, chief of the World Health Organization, has led the WHO at a time when it suffers worldwide distrust, anger and a sense of betrayal.
WHO needs more detailed information on disease severity, hospital admissions and requirements for ICU support. WHO is supporting China to focus its efforts on vaccinating people at the highest risk across the country, and we continue to offer our support for clinical care and protecting its health system.
Even the latest COVID crisis in China is being directly linked to the WHO's breathtaking incompetence and cowardly unwillingness to crack the whip on China. As the world waits to see if China's new nightmare could ripple across the world, it is a good time to remind ourselves that the WHO has largely failed in protecting the world. Failure number one. The WHO declared a global agency at least a week too late, totally allowing the initial spread of the coronavirus beyond China, a crucial week that made a devastating difference. The second major failure was the WHO's disastrous policy advisory that travel restrictions should be a last resort. This epic error practically delivered the virus to every corner of the world. The third major failure was the WHO's bumbling initial advisories on droplet transmission, confusing countries and governments and leading to disastrous lack of clarity on precautions. The most epic failure by Dr. Tedros and the WHO has been the organization's hurried approval of Chinese vaccines, which have now proven to mostly be subpar, if not completely useless, and fueling the huge surge in caseload in China. What made this worse is that the WHO conversely blocked and delayed access to India's COVAXIN, which has since proven to a far more efficacious vaccine than many of the others that the WHO eagerly approved under pressure from countries including China. Above all, the WHO has operated like a vassal of the Chinese state, barely criticizing the openly draconian and bungled zero-COVID policy of the Xi Jinping government, and in many cases defending Chinese policies. It's been 3 years since the Wuhan virus went out into the world, giving global citizens their worst living memory. As India and the world navigate next steps in a battle that clearly isn't over, it would be prudent to bear in mind that those mandated with protecting the world have constantly failed. Bureau Report, India Today.